Sadly, it's a very common thing now for girls to think that they are overweight, and for them to think that overweight means to have any type of fat on them at all. Every day, girls are bombarded with images of impossible bodies and faces, and they believe that this is how they need to look in order to be considered attractive, acceptable, and to be able to love their bodies. But they are being reached out to. More and more, people are telling girls that looking like a supermodel isn't necessary in order to be beautiful and that they should love the bodies that they have. But what about the boys?
When I'm at the pearly gates, this'll be on my videotape, my videotape. Mephistopheles is just beneath, and he's reaching up to grab me. This is one for the good days, and I have it all here in red, blue, green, and red, blue, green. And you are my center when I spin away out of control on videotape, videotape,
More and more it is coming to light that boys, starting from the early age of 7, are less than satisfied with how their bodies look. The issue for boys, however, isn't being thin, but to be muscular.
I always want to get bigger, more cut, more defined, everything. I'm never usually satisfied with my body image.
I always feel like I can get stronger and bigger. I actually feel like I still need to get bigger.
It's just constantly on everyone's mind. See the way that they look, they have the muscles, they're popular, and you're just like, maybe I need to look like that.
Some of the influence comes from their peers, but I think most of it's from media, like magazines or television.
The media plays a large role in the increase of boys feeling like their bodies are inadequate. Just like girls, young boys, teenagers, and full-grown men are being shown images of muscular, lean men. These men are shown with little to no body hair, cut muscles, almost no body fat, with angular faces that hold a smoldering stare that can make any woman swoon. It has proven true that what we see in the media is what is expected as normal, and if someone can't achieve the same body that an airbrushed, oiled, and professionally photographed model has, then they are somehow deficient or inadequate. With all these messages assaulting young boys, teenagers, and grown men alike, more and more they are turning to risky behavior to achieve these impossible bodies that they think they need. Eating disorders are on the rise among men. 10 million males in the United States will suffer from a clinically significant eating disorder at some time in their lives. Although the most prevalent eating disorders are not specified or it is binge eating disorder, anorexia and bulimia are on the rise among men, with 10% of the 8 million affected by anorexia being male in the United States alone. However, although eating disorders are becoming more and more prevalent among boys, the real risk behavior that they are engaging in the hopes of living up to the models they see on TV, are steroids.
Close up on any of the players, like basketball players or football players. You see them, you look at their arms and their bodies, it's like you just see nothing but muscle.
And they think, okay, if I gotta succeed, I gotta be that big. And they think they can't do it naturally, so they use steroids. And you really don't think about the future. You think the present, like it won't mess up my life, and really it will.
Adolescents who abuse steroids are at a significant risk of suffering irreversible side effects, including stunted growth, accelerated puberty changes, and abnormal sexual development. The major side effects of steroid use include an increased risk of cancer, increased risk of heart and liver disease, jaundice, fluid retention, a reduction of good cholesterol, high blood pressure, changes in blood coagulation, swelling of soft tissue of the extremities, and obstructive sleep apnea. With all these risks boys and men are taking to make their bodies look the way they think they need to, you would think they would be reached out to, or that they would be reaching out to others for help. But the reason there is so little data on men with negative body image who have eating disorders or abuse steroids is because they are embarrassed. When it comes to eating disorders such as anorexia nervosa, bulimia nervosa, binge eating disorder, and others, young men won't ask for help because these disorders are considered things that only girls go through. To admit to having something that is considered a girl's disease is to many men to admit that they are feminine or weak in some way. Even just admitting to the fact that they are not satisfied with how their bodies look is sometimes embarrassing because negative body image is, again, something that is exclusive to girls. Along with not wanting to admit to having a negative body image, the men who do seek help often have a difficult time finding it because many counseling and treatment services don't offer their services to men. But every day the numbers of men affected by steroid abuse and eating disorders in the hopes of looking a certain way are growing. Negative body image and all its problems aren't just for the girls anymore.